I'm Mark Heaney. I'm an associate professor of medicine. I'm the fellowship program director, chair of one of our IRBs that's focused on human studies in cancer patients, and I take care of patients. My patients come from all over. I have patients who travel great distances to see me, and I have patients that walk down the block. I see patients with mastocytosis and chronic myeloid leukemia, along with the more traditional MPNs of polycythemia vera, essential thrombocythemia, and myelofibrosis. So when I first see a patient with an MPN, the most important thing I try to do is to tell them about what the disease is and what to expect. I try to help them to understand that these are chronic blood cancers. And sometimes that term cancer is an alarming term, but I think it helps them to understand that it's a disease that's generally permanent and also a disease that's serious and requires real medical care. After reassuring them that these are treatable diseases, patients come to accept things better and also generally tend to participate more in their disease, having taken care of MPNs for a decade when phlebotomy, a treatment that was used in the 1700s and earlier, was a primary treatment. There's a real need to continue to test new medicines and identify more effective treatments for our patients. I've been fortunate to advocate for our patients with MPNs, and I've worked with the Leukemia and Lymphoma Society. I've also worked with Patient Power, which is another strong MPN advocacy group, and have really been thrilled to have the opportunity to talk with patients who have these diseases and to also let them know that they're not alone in this. Having an opportunity to have an impact on patients' lives is one of the most gratifying aspects of my job. Over the 25 years that I've been doing this, I've had patients that I've seen for exactly that long, and you get to hear about their children growing up and going to college and having families of their own, and having the opportunity to really have that journey with the patient is part of the reward of taking care of diseases like this.